Welcome. Good evening, everybody. Please confirm in chat if you can hear me. Quickly. Hey guys, good evening. Om Shri Sukalpa, Abhishek Kumar, Bhavna Dikshit, Tisha. Can you guys hear me? Am I audible as well as visible? Okay, wonderful. Right, give me a minute, guys. All right. Okay, wonderful. Welcome to a new format of Biotecnika, where we are going to go live with burning questions, solid answers, and some great insights. Good evening to all the dear subscribers and students of Biotecnika. As you all know, we all represent the biotech industry, right? So welcome to the session, guys, and today is going to be one such power-packed session. But before I get started, I have some announcements to make, okay? Now, before I even start the announcements, are you ready? Do you want to, know those announcements? If yes, then type the keyword BIO, bio, bring it on. Shall I bring the announcements on? I have some amazing announcements for all of you. Yes? Shall we do that? Okay, Abhishek says yes. Good evening, DJ. Okay, so the first announcement is we're going to go live often now, okay? But with some amazing, insightful talks from thought leaders. And we are also, and that particular series, which I just said that we are going to go live often now, this particular thing, we're going to call it as a career guidance series, okay? Approximately, it will be either at 5 o'clock or 7 o'clock Indian Standard Time, but audience from across the globe is invited and you can attend it at these times, all right? Now, that's the first announcement, but I have some more. Do you want to know more? I have some good news for you. So, all the students, all those subscribers who are preparing for CSIR NET Entrance Exam, and if you're from India, you know what it is, we have something amazing coming up for you. And that is, you all know that CSIR NET Life Sciences has got 3 parts, right? Part A, Part B, Part C, correct? Part C is the most valuable, most scoring, as well as most dreadful, right? It's a win-win situation if you can answer them, all of them correctly, and if it's a mistake, it takes a complete 1 mark, right? So for CSIR NET, I'm coming up with something great for all of you, okay? And that is gonna be Part C question discussion sessions, unit-wise, topic-wise, okay? So Part C discussion sessions, unit-wise, topic-wise, and that will start from tomorrow, okay? So the career guidance series will be there, as well as this particular series will be there. These 2 series will go hand in hand, okay? So Part C question discussion series for CSIR NET, as well as career guidance series, right? So I have come with 2 great news. Now we'll start with the topic, right? So how does this sound? Are you excited? Yes? Wonderful, wonderful. Now, for best experience, I recommend all of you to please use earphones so that my audio is completely clear, because at times there can be some disturbances. Okay, if you are from Pakistan, still you can attend the career guidance series because that will be equally valuable to all of you. Okay, so of late we have garnered a lot of cross-border subscribers, not just from Pakistan, but from Bangladesh, from Nepal, Sri Lanka. We are seeing subscribers from European Union, USA, as well as Germany, Ukraine also, Russia also. So we have subscribers from across the globe, and that's what makes Biotecnika unique, and that's the reason I said So this particular career guidance session is going to be for everybody. Okay. Now, for all our Indian subscribers, here is the Telegram link. Okay. It is t.me/biotechnika. Okay. Please make sure that you are subscribed. Are you guys here? Let me check. Everybody, are you already on our Telegram? Have you joined our Telegram group? Yes. If not, please, I'm sending you the link right away in the chat box. Please use that and subscribe. Make sense? All right. Yes, Abhishek, Biotecnika has got a global audience, and this global audience is demanding us to come up with more innovative things. So today's session is one such initiative, okay? And more such initiatives will come in the future, right? Now, these sessions are going to be pure, solid, credible talks on various topics. Today, I'm starting with one of them, and that is overview of the global biotech industry, including their current trends and future prospects. And it is not going to be like I come with a PowerPoint and I will talk. No, I'll come up with some points and I will take inputs from you all, and you can have a Q&A live right here while I'm talking. Okay, so that it is valuable for everybody. Okay, so that's how we're going to work, guys. Make sense? Ready? Okay. So now, how many of you are from the biosciences industry in India? And how many of you are from out of India? Can you just ping me in the chat box quickly? How many of you are from India? How many are from out of India? So that accordingly, I'll customize this session. All right. Now, basically, I'm going to talk about the global biotech industry. So don't worry, even if you're from out of India, it's still going to be relevant to all of you. All right. So quickly in the chat box, everybody, tell me which particular country you belong to, India or out of India. Right. So while all of you are typing, here is the first point for all of you. And that is, when we call it as a biotech industry, that becomes narrow, but actually we should call it as a life science industry. Okay. Now, what is life science industry? It starts from agriculture, and it goes up to industries. Starts from agriculture, food, then it goes to your medical devices also, medicine also, pharmaceuticals, right? And then various biosimilars, biologics, all this will come under the life science industry. So basically, popularly we call it as biotech industry, but the truth is it's life science industry. Okay. Okay. So Europe. Okay. Hi, Donald from Europe. And okay, rest everybody is from India. All right. Okay. Wonderful. Fantastic. So people, you look at this. We should not confuse in between life science industry and the biotech industry. Clear? Okay. So basically, it's life science industry. Now, let's look at the next part. The biotech industry, or say, whenever I say biotech, please presume that it is life sciences, okay? So the life sciences industry has seen significant growth in past several years. Now, what is the driving force behind this? Anybody tell me? What is the driving force behind this growth? Before COVID, I'm not talking about COVID. Before COVID, what was the driving force? In India, it was the biosimilars and patented drugs whose generics we could make, right? Abroad in US, it was purely innovation R&D into newer diseases and rare diseases and all that research, right? Now, one thing, all of you, no matter irrespective of which country you belong, you should know this. American government, European governments, Chinese government, as well as Indian government. All these governments have realized the power of biotechnology with the rising population, food scarcity, changing climate, and of course, ever growing, ever rising diseases. And in the middle of this, COVID happens, where now PCR is a, home name. Everybody knows PCR, right? So the world today, if before 2019 was facing X problems, after COVID, people have realized that it is facing 100X problems, right? Otherwise, there was no need of somebody going and doing research on all these things. I can see from the place where I sit, and I'm in talks with various analysts across the globe, that now with the advent of newer IT tools and technologies, the acceleration which is happening in the biotech and life science industry is incredible. Okay, so yes, Godavari, that's right. So I would like to highlight Godavari's point. COVID-19 just tipped everything over the edge, right? Now, I am not sure how many of you are aware of the biggest mountain, right? Biggest mountain of waste which sits outside Delhi in Ghaziabad. How many of you have seen that? Okay, there is a query from Anand Kumar. He has not received the coupon code or the certification codes. Anand, I'm aware of that. I'm not keeping well. That's the reason I could not mail you. You will get it. Okay, if not today, maximum by tomorrow, you will get it. And this is for all the students who attended last week's workshop. You're going to get it. Okay, so yeah. You have seen it. Ishika has seen it, right? I'm sure if you are from Delhi, you have seen that, right? So, waste, human waste, electronic waste, right? Bio waste. When combined with all the things, it's becoming a huge, big problem for humanity now, right? And that is where humans are going to face challenges. And that is where more dollars are going to flow into the biotech industry. But now, what is the size of biotech industry? As per the last estimate which we had in 2021, this particular industry was valued at $758 billion. I'm talking about the life science industry, not only biotech. So this includes the pharma also. And it is expected to cross $1 trillion by 2025. Okay, but where is the money exactly in this for you all? That's something you should know. The money sits where the investment goes. Okay, now why the biotech and pharma industry is growing at this rate is because now we also have a pandemic to support it. And furthermore, all the climate change, waste management, all the consumption issues, food scarcity, accompanied with recession, is now attracting more of IT giants also towards the biotech industry. Many of my videos I have said that, right? Now, where we will make money as biotechnologist or a life scientist, which you all call yourself, right? Where you all, I will, and you all will make money. That's where we are interested, right? So let us understand the market fragmentation right now. United States of America has got 59% of the market right now. China owns another 11%. India, somewhere around 2% it is. It may grow a bit more, but yeah, right now it is sitting at this number, right? Now, one thing which you all will think is, okay, India is smaller, right? So I think there is no growth going to happen here, right? Is it so? Is it so? Anybody tell me? So that means India is not going to have any growth? Is it so? No, it's not so. Now, let me tell you. In the year 1990, many people, okay, who were asked to buy shares of Infosys, they said, who will buy Infosys shares? This IT and all this will never happen. It's better handled by Americans. We can't do it, right? But the people who believed in Infosys and bought those shares today are multi-billionaires, okay? And it's not me who is saying, you can go and Google and you can search out. There are many people who have posted on internet that I regret that I didn't invest in Infosys shares if I had done that. So basically, there will be one visionary who will change everything, right? Infosys is an IT company in India. So basically what happened, let's look at that now. Basically, Infosys was able to outsource the American demand to India. right? Now, what is happening in today's world? India has got tremendous manpower in terms of life sciences and others, right? And they are cheaper, right? Indians can work at a lower cost because we spend in rupees. So the next 10 years, the growth of industries in India is going to be tremendous. And I have a personal interest in this. That's the reason I have come live today. I want to help you and I want to grow this industry in India, because any small drop also in this ocean is going to have big ripples. Okay, that's what is going to happen. So that's the point I wanted to make, right? So yes, Anand Kumar, last 10 years grows a lot in life science. We have seen a lot of growth in life science in last 10 years. We're going to see 100 times more growth, and mark my words, we'll meet in 2033 and you will say you were right. Now, where is the money going to go in? First, personalized medicine and gene editing. These are the most promising and exciting biotech current trends in the industry. Okay. Now, genome editing, when I say which technology comes into your mind, there's one which we call it as CRISPR, right? CRISPR is the name. Can anybody tell me CRISPR's full form? Let's see who knows the full form of CRISPR. Anybody? Tell me the full form of CRISPR, guys. Okay, all right. So personalized medicine. Why personalized medicine? Because the gene pool is different. What works for Europeans may not work for Indians. What works for you may not work for me, right? But so far we all have a generalized approach to medicine. So personalized medicine is one thing which is going to boom. Next is gene editing. Okay. Now, gene editing is going to alleviate a lot of diseases. Now, the best part of gene editing is going to be the next point which I will say that will actually have. But for now, yes, let's accept it. Gene editing, right? Okay, CRISPR, yes, clustered. Dhanush is right. Clustered, regularly interspaced, short palindromic repeats. Now, this technology has got so much power that the head or the people who found this or discovered this technology, both of them today are sitting on billion-dollar companies, and Pfizer and all these big pharma is approaching them to get their projects done by these. Editas is one company, right? So that is where genome editing is coming to happen. Now, what will drive growth in India is the biologics market. Okay, it is expected to grow continuously, and it is driven by the development of new drugs and therapies, right? And right now there are 3 to 4 mega companies you have in India. Biocon, you have Dr. Reddy's, you have, right, Bharat Biotech. So these are companies which are into this, right? But the next phase of growth is not going to come by wet lab. Now, this is something which all of you should note down. Okay. Yes, Anand, stem cell culture is also one field which I'll come to, right? So I want to repeat this statement for all of you. And that statement is, the next phase of growth in the biotech sector will not come from wet lab. It will come from something which we already know. What is that? Bioinformatics. Now, why bioinformatics is easier than the wet lab? Now, you will see bioinformatics in its applications in all forms of research grow by 1,000 times in the next 5 years. And that is why we always have told you that, guys, you're going to miss out this grand opportunity if you do not pursue bioinformatics, right? Many biologists email me, they will say, sir, I don't think we are going to need this, right? But here is a question for you. Do you think the future R&D will be done in the wet lab? No, first it will be done in the bioinformatics software inside, virtually. Once you have realized that, okay, it is doable, then only you will jump to the real physical world and do it, right? And that is where our latest offering comes into picture. Now, for all those students who have been working hard in wet lab or plan to make a mark in the future research career, which I'm sure all of you do, you should know two things here. Okay, and the first among them is the bioinformatics softwares you should know. This is going to be a game changer. Wet lab. Okay, there's a question, what is wet lab? Wet lab is where you work with chemicals in the real world, right? Dry lab is where you don't work with chemicals, instead you work inside a computer. For example, right now I'm inside a computer. You are watching me inside a computer. You can call it a mobile, but it's actually a computer, right? Mobile is nothing but a portable computer. That is where, for bioinformatics, ladies and gentlemen, boys and girls, we have this internship, which I am sharing the link in the chat box. This particular internship will be done by none other than our Farhan Zamir sir. Right now, as I'm speaking, he's training students for cheminformatics, and I'm talking to you. He told me this one line before I started this session. And he said, sir, just like Infosys shares, if somebody does not sit on the bandwagon of bioinformatics, they will regret 20 years later. This is his line, exact line. Okay, so bioinformatics is going to grow 1,000 times, and if you are interested in bioinformatics, this particular internship, it's a 21-day internship which you can opt for. Okay, now I'm not here to advertise about this internship. I'm just telling you because this point has come up. Bioinformatics is going to be a game changer. Please start learning. Okay, some questions are here, which is Zodius Plus. Wet lab is doing experiments. That's right. Shivraj, is R one of the tools for bioinformatics? Yes, that's right. That's a language. Please tell me about wet lab. So wet lab is like you go to a lab and do some research, okay? Omics, it's a part of bioinformatics, right? Proteomics, genomics, yes, that's the future. Python, R programming, I'll come to that. You guys have caught me right there. You are one step ahead of me already, right? Now, what makes me more positive about bioinformatics is this thing. I'm sure most of you have already worked in a lab, and you all have faced this problem initially when in your initial days you used to focus the microscope and it'll be so difficult, right? What if I tell you that in future the microscopes will be able to focus themselves and all you have to do is look in, right? Even they will be able to take the samples, take pictures of the samples and analyze and tell you what exactly the microscope is seeing. Yes, that is where, ladies and gentlemen, boys and girls, artificial intelligence and machine learning comes into picture. Now, for all those people who do not believe me, let me tell you a story about radiology. Okay, so I have a friend. He is a radiologist and he has a biotech company. He's a radiology company actually, which is AI in radiology. So basically, you get an X-ray from a village and the AI will scan the X-ray and tell what exactly has happened, right? It's not a doctor. It's the X-ray being scanned by a AI and telling what exactly happened. So using machine learning, right, radiology is going leap and bounds. And the same thing is going to happen to your wet lab. Artificial intelligence and machine learning is going to revolutionize it. Now, that is where the money is going to go in. Okay. Now, if I say, okay, there's going to be money in AI and machine learning, how can I earn from it? Let me come to that. Right. There's a question from Godavari, arguments against traditional ethics that biotechnology, since its inception, has been continuing to defy. Godavari, ethics and science are two different subjects. Let the politicians and other committees discuss the ethics part. We as scientists have to pursue science. I think that's the best answer I can give you here. All right. So now coming to the point which I was making, artificial intelligence and machine learning is going to revolutionize and in ways which you cannot imagine. For example, this camera right now, right? Can you see that it is focusing on my face while the background is a slight blur, right? Slightly blur. How it is happening, right? It is happening because of a thing which we call it as Artificial intelligence. For example, see, I will try to blur myself. Can you see now? So the background is blur, right? And this is actual, right? How it happened? It's artificial intelligence, right? Same thing will happen to your microscopy. Same thing will happen to your anything which you do in the lab. So artificial intelligence and machine learning is going to further improve it. But hey, this is just the tip of the iceberg. Let me tell you the entire iceberg, and that is quantum biology. Quantum computing is here to stay. Quantum computing has already been innovated. But the only thing is that quantum computers today are of the size of big computers of 1960s. Right, the same way mainframe computers were. Today, quantum computers are as that big. So, quantum chemistry and quantum biology is going to take leap and bounds, right? And that is where artificial intelligence and machine learning is going to go even further. So that's a trend which you should note down. Okay. All right. So do boys and girls have the same opportunities in biotech sector? Of course. Now here is a thing which you all should know. Biotechnology industry in particular is very women friendly. It is so women friendly that a woman is one of the biggest founder of a company in India called Biocon, right? So it's not gender specific. It's irrespective of the gender. You can do research, you can become scientist. Now here is a point which I wanted to make about artificial intelligence and bioinformatics. You can either develop softwares for bioinformatics or biology. That is where you become a biology software engineer. So where is biology and software engineering comes and merges together, right? So you as a person know biology already, right? You as a person already know biology. But if you know coding, that is where this is going to go ballistic, right? And that is where, ladies and gentlemen, boys and girls, comes the next internship which Biotecnika has. We call it as Coding for Biologist internship. This is going to be a live internship starting from 15th of February. If you are interested, you can opt for it. Right now, both internships are at a 50% discount. If you want, you can avail. But these two internships are going to be game changer because artificial intelligence and bioinformatics is coming to get you. Whether you take it or you break your career, choice is yours. Now, I'm not trying to create a fear here. I'm trying to tell you that my experience of 17 years is getting challenged here. I am seeing artificial intelligence and machine learning doing things which I've never seen done earlier. In 1 year from now, biologists will be discovering new drug molecule using artificial intelligence. The way it is today that you send an email and it is free, right? The same way tomorrow in the future, you press a button and a new drug molecule is found will be a reality. Mark my words, 3 years from today, that's going to happen. All right, so this will further increase the investments. Okay, now, investments of what? Now you see, our economy is what? Capitalistic economy. Agree? So what happens in a capitalistic economy? We face only one thing, profit. If results are coming, if there is profit, you're going to get it, right? And that is where you will find more money coming in because results will be faster because of 3 reasons: bioinformatics, AI and machine learning, and quantum biology, quantum computing. When these 3 things get combined, results will be faster. And when results are faster, more investors will put in money because now computers are involved, so you get guaranteed results, right? And that is where this will explode. And that is why I said from 2% market share, India is going to explode into 25% market share. Remember, in America or Europe, we had first the landlines, right? Then the brick mobile phones. then the small mobile phones, and then the smartphones, right? But in India or Bangladesh or Pakistan, what happened? We leapfrogged. We didn't had that so much of landline penetration. Before that, only the mobile came, right? The same way, India will take the technology from across the globe and it will leapfrog into the next generation. Leapfrogging is the key to growth in the biotech sector. So you need to leapfrog by learning bioinformatics and coding. If you learn coding, you can become a biologist software engineer who can develop software for the world, right? That's what's going to happen, right? All right. Now, coming to a question, very interesting question from Mr. Biotechy, and he says, what about synthetic biology and its scope? As you said, stem cells, quantum biology, a growing field. You see, synthetic biology is a field of growth where investments are pouring in, results are not very credible, but yeah, it is going to come up. You will see another 7 years, synthetic biology will grow. So I can give you dates and timelines, okay? For example, bioinformatics, 2 years. More than 2 years, you don't require for it to explode. Drug discovery, 2 years. But synthetic biology, it can take up to 7 years. The incubation period is a little bigger. But yeah, you're going to see synthetic biology also grow. Okay, I hope that answers your question. All right. So now, while all this we are discussing, we forgot one thing. Virus, right? Vaccines. Pandemic showed the way. Vaccines, treatment for pandemics, emerging diseases, major focus. While all this was being discussed that this will happen, that will happen, suddenly vaccine, right? Now, why vaccines are important, we know it, right? But here's the thing, dude, before pandemic, we used to see 5 years, 7 years in development of one vaccine, right? One vaccine we used to take 7 years. Clinical research, bureaucracy, delays, government not approving, FDA, this, that. But what happened? What changed? Moderna's vaccine is completely created inside a bioinformatics software, right? And it was done by Indian scientists only, right? So that's where I'm saying vaccines, vaccinology, this vaccine science and virology, all will come together, right? In fact, I'll tell you, this is a proprietary information, so I cannot disclose it completely, but I had already disclosed in one of the videos that I was sitting and watching the scientists showing me how exactly, what are the possible variations of COVID and how their future drug vaccine will actually cure it, right? So it's like a cruise missile, right? If the target molecule changes for COVID, the vaccine changes itself and still attaches, right? It's huge, okay? All right, so that's about the development of new vaccines, and which has got accelerated because of the pandemic. Now, for all those naysayers and for those people who can't see the future and say that, no, there is not going to be any growth in the biotech sector, you are mistaken. And here is a point I want to make to all of you, right? How many of you are from IIT and how many of you are not from IIT right now? Anyone is from IITs of India, Indian Institute of Technology, or some big institutions, big institutions we call them. So I have seen this. So many people who will go on Biotechnika's videos and say there is no scope in biotech. When I go and look into their profile, like yesterday we posted this, image. Okay, if you're not from IIT, good. Then, you will get my point, okay? So people from IIT will not get my point here, okay? And that is, so we uploaded this image which says that somebody's laughing, okay? I'm sure you all have seen that image. Have you seen that image? Let me see if I can bring that over to all of you, right? So that image, if you have seen yesterday, I uploaded on our Telegram channel, right? If you have not seen, let me see if I can send you that link here, okay? Give me a minute. I'll just try to quickly scroll and send you that link, okay? Afterwards, you can see it. So Yeah, 1 second. Let me just pull that image for you. Yeah. So what happened is we posted this on entire social media. Okay, let me put this. And now this gentleman comes on Instagram and says that Indians can never win Nobel Prize, or because of all the research issues and blah blah blah. Right? I asked how Hargobind Khurana did. Right? Okay, you can't. I'm not saying everybody will win. Right? But it's not that Abdul Kalam didn't got a Nobel Prize, but he was a great missile man, right? He did so much for the country, right? I'm not saying everybody will win a Nobel Prize, but if you see that link I've sent you there, if you guys can see that, okay? So that is just about encouraging people to pursue science. Nothing, no offense. But the guy who is complaining about this, I'll tell you his profile. So this gentleman has done his BTech from BHU. Then he's done his MTech from IIT, and now he's working in Dr. Reddy's, and he's saying there is no future of biotech. I was like, dude, you are placed in Dr. Reddy's, and you're saying that. I was like, how is it possible? This is so bad. This is so upsetting. And then I remembered that the people who are sitting in IITs, they are making such statements. But 10 years later, you will find the same guy sitting in a big pharma company as a big scientist. But jinhone inka baat suna, the people who heard them would be sitting as losers. So please don't listen to such people. They have themselves achieved so big success working in a Dr. Reddy, and he's saying all this. Right? Batao. So it's not that you cannot do it. It's just that you need a strategy. Okay, so the development of new vaccines is going to come up, okay, and that's going to be a huge thing, right? Okay, let me just see if I can bring that image here, if I have some way of doing that. Yeah, so let me see if I can bring that up. No, it's not coming here. Okay, never mind. We will see if I can bring it up later. So that's what is going to happen. The vaccine things is going to come. Now quickly, regenerative medicine. So that's where somebody had pointed that out. Stem cells. Regenerative medicine, stem cells. This is going to revolutionize. Now what happens right now? When somebody's kidney fails, or somebody has a accident and he has lost his, suppose, eye or something. Now he has to wait for a donor, right? In future, you don't need to wait for a donor. Your stem cells will be there in the stem cell bank, and they're going to work on this. Now, you can argue that this is never going to happen. It is just like we're sitting in a pre-plastic era arguing that there will never be plastics, right? But today plastics are a big menace, but forgetting that part, yeah. But in the era when there were no plastics, people arguing that there'll never be plastics, right? The same way. So instead of doing that, as a science student, you have to pursue. If your interest is in stem cells, this is a field which is going to grow. Okay, and mark my words, in the next 5 years, okay, 5 years, already there's a lot of breakthrough. You will start listening doctors, replacing damaged kidneys with the stem cell generated kidneys. Okay, stem cell generated various things will start happening. 5 years. Just wait for 5 years. This is going to happen. Okay. Now, how many of you have seen those science fiction movies, right? What used to be science fiction is today reality, right? Like video calling is a reality. Agreed that biology is a bit advanced science, but that's going to happen, right? The next phase of growth in science is going to come from biology. Okay. Now, here is the thing which you all should know. The trend right now is cost-effective and efficient healthcare delivery. Okay, and that is also going to drive the biotech industry. And that is the telemedicine and wearable devices. I don't have one because I'm not that rich, but yeah, Apple Watch, Samsung Watch, all these Fitbits, right? Now, what is interesting here is they have sensors, right? Biomedical sensors. Now, these sensors is what? Biotechnology, right? Now, I'll tell you, so last Saturday we had this workshop, and I'm sure most of you attended. And Yeah, so Anand has attended the stem cell workshop, and you can see that he learned a lot from the workshop on stem cell. Last time we had, last Saturday, day before yesterday, we had this workshop on bio-entrepreneurship where we brought in a great entrepreneur, serial entrepreneur and scientist, Dr. Pratima Khandelwal, ma'am. She recently received a patent on biosensors, right? Now, what happens next? She can easily sell it to Apple. She can easily sell it to any company which wants to use that biosensor. Now she holds the patent, so she can sell it and become a multi-millionaire, right? So innovation in the lab combined with the patent, sell it to a big company, become a billionaire. Shortcut, right? You don't even need to do anything. Just find that thing. That's where it is. Okay, so healthcare delivery. Right. For example, right now, painful syringes are there, and future there'll be patches. Right. What if you find a better patch? Right. That's where the money comes in. Okay. Now, who is going? Okay, we are saying, sir, okay, this will happen, that will happen. Future तो बहुत अच्छा दिखा है, but सबसे बड़ी बात तो ये है. The biggest thing here is India and China is going to be the biggest consumer of biotech products. Okay. Now, why do I say that? Why do I say that? India and China is going to be the biggest consumer because Indian and Chinese population is the highest in the world, right? Now, if you have ever calculated, okay, if you sit with maths and if you have ever calculated, in the most populous cities of India, there are more than 5,000 people living in 1 square kilometer. That's the statistics, that's staggering statistic, right? Imagine population. Right. So when 5,000 people sit or stay in one common locality, like 1 square kilometer, imagine how many people are there, and all these are going to be consumers of biotech products. And that's what I always tell you. If you want to start a company, start a simple biotech company, you're going to go in crores, not crores, billions of dollars. Okay, that's the point. India and China is going to be the biggest consumer, and they can't stop consuming because they have population, right? Somebody will always be there to buy. Right. So here's a point for all of you. If you want to win big in the biotech industry, innovate. Go deep dive into science and in-source what is being outsourced from US, UK, Europe, China, Japan. Whatever resources are there in India, utilize it. And if you are from out of India also, okay, look at how can you outsource it in a cheaper way. You utilize Indian scientists or scientists from other countries, and then create a product and sell it to the global population. That's where the key is. That's how Infosys and all these IT outsourcing companies gain big momentum. Okay, so the Atmanirbharta, what do we say, or we need to create products, biotech products, and sell it to the globe. That's where India will shoot from 2% to 25%. Okay, that $5 trillion economy, probably India could, the biotech sector could contribute 500 billion from India, right? So the biotech sector globally is going to expected to continue to grow in the coming years by leaps and bounds, driven by advanced technologies such as quantum computing, the demand of healthcare and growing population, and of course, very important, supportive government policies, right? So many of you who are listening to this talk today are going to be a part of government in the future, right? That's how many of my students today are sitting in DST, DVT. How I have built contacts, this is how I have, right? You'll not believe, before the notification is released, I will know it because somebody will be my subscriber or my student who will be sitting on these departments, and they'll call me, sir, this is going to happen, be ready, right? So tomorrow you are going to be a part of the government. If you ever become a part of the government, please be friendly to the biotech industry, because this industry is going to get you a lot of dollars, right? So this is all I wanted to talk today, and now I'm open to Q&A, right? Even though I tried to answer a bit in the middle. So I'm open to Q&A. Next, I think 10 minutes we can dedicate for that, right? So everybody start posting your questions, and I'll take that up one by one, okay? Okay, so for Anand Kumar, question is Java needed or Python is enough? I think Python should be sufficient, not enough, but sufficient to get started. In future, you may need other languages, but as long as you know Python, more of it, it should be done. And I think you should talk to Farhan Zamir sir. He'll be in a better position to guide you on this. Okay, there is a question from Biotechy. I love your name, Biotechy. I always call myself a Biotechy. That's a nice name. Make a video that when and where we can pursue PhD in synthetic biology with best private institutes and labs. So somebody from Biotecnika team, please note this down. That's an amazing topic. I think we should pursue that. It's a, if you ask me which topic I would have done my PhD, it would have been either gene editing or synthetic biology, something like that. It's very exciting. So Godavari, thank you for the session. Thank you so much for attending, and I'm open to questions. Please go ahead. I've made my points, and you can see here. So pure facts, solid vision. I didn't talk with the PowerPoint because all the data is right inside here in the head. I thought making a PowerPoint will be a waste of time and energy. Instead, I can straight away, given that I'm a good communicator, I can pass on all the information to you. So yeah, I did that. All right. So Godavari also says that it was very prospective and motivating, and happy to choose biosciences as a major. Thank you, Godavari. It was a pleasure. The pleasure is entirely mine. You see, there are a lot of people who are talking about all the darkness in the biosciences industry. The thing is, they can't see, they don't have a vision. That's why they see darkness, right? Okay, Syed has a question. Personalized medicine will grow? Of course it will. Now, why it will grow? Let's talk about that, okay? Somebody tell me, why do you think it will grow and why do you think it will not grow? Anybody? Why do you think it will grow and why do you think it will not grow? So guys, I have a bad throat, so I need to keep hydrating myself. Otherwise, I'll not be able to speak. So apologies for that. So my points, my 2 cents to you, Syed. My points. The generalization cannot treat everybody. Okay, for example, you look at the cancer part. You can't treat cancer with a general drug. You need to, titrate it according to the individual, his malignancy of the tumor and all that stuff, right? So in future, you will see personalized medicine taking over, right? Generic chemical medicine is not going to help, right? That's where the growth will come, okay? So, all right. So next question, Abhishek Kumar Bharti. Thank you so much. You have a nice name, Abhishek Bharti. After MSc, which is good, PhD, MTech or industrial job? Okay. So you mean to say that after MSc, what is good? Should I do a PhD or MTech or a job? Okay. So here is my 2 cents for you. PhD. Why? Because there's a problem, especially in India. And that's a problem with the education system, not with you. And that is, after the age of 28, you can't do PhD with a fellowship. That's stupid rule, but yeah, because of that, you can't do a funded PhD. Because of that, you have less time as a male member. So it's better to finish it off. Okay. So that's where it goes. Now, if this rule was not there, I would have said, go for the job, and later on, anytime, whenever you feel excited, you can always do your PhD. But yeah, that's where it hurts. I know it hurts being a male member. Shivani has a question. Nice name. Does freshers microbiology can do bioinformatics job by having an internship? Yep, you can do. So what kind of jobs you can do? See, in microbiology, you can apply bioinformatics. You can become a hardcore, pure bioinformatics software engineer, software developer. Even that can be done. But you need to do deep dive. Internship is basically a start, right? For example, I learn ABCD and I'd say, can I write a sentence now? You can't, right? But ABCD is the building block. So yeah, this internship which I'm talking about, it'll be a start. Right? But on the top of it, you need to gain a lot of hands-on experience by taking up projects, right? So you can just volunteer for bioinformatics projects in companies, do that. That's how you'll gain experience. I'll tell you my story, but like, how do you think I know all this? How do you think I know all this? Because I interact with a lot of people, I have network, right? So the same way, you have to reach out, okay? So that's the question for Shivani, okay? Animon. So Animon, am I pronouncing your name correctly? Animon. I have contacted many on LinkedIn, but can't manage to get an internship after BSc, even though I have done pretty well in my academics. That's where the problem is. You can't get there just by messaging people on LinkedIn and demanding things from them. For example, I'm on LinkedIn and somebody messaged me, I want a job. Do you think I'll reply? No, I'll not. Instead, if you volunteer and say, sir, I saw your post, it's very insightful. Okay, first interaction. So you bring familiarity after 7 days, 10 days, or a month of interaction. Then finally you say that, sir, can I get a chance to work under you? Because I'm really a big fan. Then it comes. Right. See, networking, I think we're going to do a session on networking also, Animon. So that is where I'll teach you. You just can't message on people on LinkedIn and demand and people will give you. It doesn't happen that way. Okay. Best fields for interdisciplinary research. Okay, that's a question from Tanveen Kaur Soni. Nice name. Again, Tanveen. Wow. Best fields for interdisciplinary research. Anything which combines physics, chemistry, and biology, but is revolutionary. So, okay, if you combine computer science and biology, that's one thing. If you combine like physics and biology, okay, chemistry and biology is anyways interrelated, so that's all right. So these are the two sciences I can recommend, especially computers and biology is amazing field. Okay, anything wherein you merge computers with biology is going to be great. Okay, and in my view, that's where the future lies. Okay. One data point I have not included in this session is the storage of data into DNA. That's something on which Microsoft is doing extensive research. And if that happens, that's going to change everything, because today, I'll tell you this way, the entire YouTube can be saved. The data of entire YouTube can be saved in one strand of DNA. Okay? That's the power of biology. Now talk. Think about it, right? So yeah, interdisciplinary sciences, that's one of them. How to start after a gap of 6 years after MSc. Pooja, I uploaded today an amazing video. In fact, I have made 3-4 videos. Please check our YouTube channel. If not, please email me. I'll send you the links. Okay. So that's Pooja. Next, Alapati Fani. Okay. Alapati Pani. Sir, can we expect tie-ups of biotech industries with schools also in future? So, well, CSIR labs have that. Biotech industries, why would they have? So, unless it's a government forcing biotech industry, they won't do it. Okay, because these industries are profit-driven industries. They will not be interested in charity. So, I don't think so. They may happen. It may happen. Okay, yeah, Biotecnika can do it. That's for sure. So Biotech, yes sir, thank you. I'm proud to introduce myself as a biotechnologist, even though I feel I got stuck in my life, as it seems my friends got a good career. That's where the comparison comes in. Don't do negative comparison. And yes, I also would love to call myself a biotechie. Donald, if I remember, you're from Europe. So do you accept and train interested biotechnologists or bioinformaticians from abroad in your industries? Yes, we do. We can do that. You can always email me, reach out to me. I will guide you on that. Okay. Okay, all right. Shiv, I'm confused between PhD or job because the pay is low and personally I feel the amount of work it's low. Okay, I'll give you an example of Infosys founder, Dr. Narayan Murthy. When he started Infosys, he had to borrow money from his wife because he could not pay himself in Infosys. So initially, everything will be low, okay? But slowly it grows. I know ITC scientists getting a package of 75 lakhs per month. Per annum, sorry, not month. 75 lakh rupees, Indian rupees, okay? So, but he has 20 patents, right? Okay, what's the scope of 3D printing in future in India? 3D printing, bioprinting, yeah, 3D bioprinting. So 3D bioprinting in food, possible. 3D bioprinting in organs, possible. But a lot of investment and research is required right now. It's not going to happen very soon unless quantum computing comes in. So, and of course, we need to have biomaterials. So development of that has to happen. But the moment these two things happen, it is going to grow. So not just India, across. And let's put it this way, that tomorrow we'll be able to we don't need to cook food. We'll be able to just press a button and print food. That's going to happen. Pragya, did my ME and BE in biotechnology, are there any government industries for job? There are many, Pragya. You can reach out to Biotechnika's job section. There you'll find. Now, there's an important announcement for everybody. I forgot to mention here. Biocon has got a corporate social arm called as Biocon Academy. I'm sure you all know it. Biocon Academy has this amazing feature wherein they take up students, train them expose them to industries, and then they place them. Okay, so it's a 18-week, okay, around 140 days course which Biocon Academy has. Right now the admission is going on, and this morning itself I was talking to the Biocon Academy team. Let me just pull out that link for all of you, and I will share it right here. So what happens is Biocon Academy is doing a great job, and it's a corporate social responsibility. Basically, they are spending more than 10 lakhs per student. Okay, and I would suggest all of you to look out at this link. If you like it, please do register here, because Biocon Academy is closely associated with Biocon. You'll be able to interact with scientists. You'll be able to interact with a lot of bioprofessionals, and the directors of this academy, a very good friend of mine. You'll get a lot of chance to network with them and their network, and that's gonna be a great thing. What the fees is, you can inquire everything about that on the website. Okay, and they'll guide you. All right, so questions flowing in, and I'm slow. Okay, I have to be fast. Is it better to do MSc or PhD post-grad? Godavari, like general topic or specified subject, like doing MSc agriculture instead of MSc horticulture? I would say the master's should be broad, and the PhD obviously anyways will be specific, right? But whatever you do in PhD should be commercializable, otherwise it's a waste. Okay, so that's something you should know, right? One line answer. Quickly, I'll move on to the next question. I'm confused between PhD and job because the pay is low. I answered that. Okay. Disha, because of population, answer that. Okay. How is it possible to learn hands-on training online? Interesting question. Bioinformatics is software, so you can do it at your home, right? Because this will be all softwares will be given to you. And if it is anything else, demonstration is given, right? And let me answer this question in a more specific way. When you go for a job interview, they're not going to ask you, go to the lab and do this and come back, right? Because they don't have time for that. They will ask you theoretical questions. That's what gets you a job. So, hands-on comes later. Theoretical knowledge is very important. Applied knowledge is very important. Data interpretation of the knowledge is very important. Okay, so just knowing chromatography or some technique PCR is not going to help. You need to know the theory. You need to know the data interpretation, and both of that demonstration can be done online, right, Suruchi? Okay, how is biochemistry from CUET Hyderabad MSc? Not sure about that. So far as I know, if you're talking about University of Hyderabad, it's good, but no personal comments here about that. Where can I personally contact or email you? Okay, Pooja, you all should know this. Okay, my email ID is this, and I'm going to display it on the screen as well. You can reach out to me directly. Okay, most of the questions I answer them instantly, but being a human, I have limitation. If you want a guaranteed reply, then send it at 4 o'clock in the morning. Okay, because that's when I'm fresh, and I'll definitely do it. 4 o'clock in the morning, you can get a guaranteed reply. Okay. Next, so please go to university for PhD in neurosciences. I know one of them in Israel. One of my friend has done it there, and of course in India you have NIBMG, National Institute of Brain Research. Okay, NIBR, I think, yeah, NBR, sorry, NBRC, I'm so sorry, NBRC, okay. So this is the link, guys, for the Biocon certification program. You can check that out. And coding for biologist, is it live, and what is the timing? So it's live, yes, it is live, and I think it is, the timing should be 5 to 6 or 6 to 7. I'm not sure about that. You can ask in chat support. Generally, the internships are 5 to 6 or 6 to 7. Okay, 1 hour of training and then 1 hour of practice. So, or half an hour of training, half an hour of practice. This is how they design it. Okay, and there'll be assignments for you, right? Online training free program in Biotecnika. So we occasionally keep doing that, Shweta, but for now it is not there, okay, because we need to feed our people because they're hungry, right? So yeah. And yeah, so that's my email ID, guys, for all of you. You can ask me any question later on, right? Thank you so much. And yeah, Biotech is, I got a suggestion from me that as you are from MSc Biotechnology, it is best to do PhD in biotechnology. Otherwise, getting good career in government job is difficult. How much is that true? No, that's not true. That's stupid. No, that's not true. Okay, what's true is for a government job. Okay, I should tell you this, that 1 out of every 400 person gets it. So it's stupid trying for a government job, but given the chances of success. But if you are hell bent to do it, please do it. But you don't really grow in the government, you really grow in the private sector. If you ask me personally speaking, that's the choice I would make. But yeah, you are free to do that. Okay, Godavari, most welcome. KG Gaming YT, I'm sure you love gaming. So I'm interested in industry, but I have confused about subjects to choose for MSc Microbiology. Drop me an email, KG Gaming. I will answer that a little later because right now we are running out of time. It's already 8. So without PhD, can we get in good position in 5 years? Yes, you can. There is a video for that. Do you need PhD really for growth in biotech industry? I've done that, Shivani. Please check that, and that should help you. Question from Jaya Kumari. CSIR NET or DBT, which is better? One line, CSIR NET hands down. DBT, you can write as a backup, but the problem with DBT is going to be, you have to prepare for something which is, marine biology, I guess. But on the top of it, if when you prepare for CSIR NET, DBT automatically gets prepared. So you should write both, but prepare for CSIR NET and write both. Okay. But funding wise, both are almost the same. There's nothing wrong, and both of them are pretty good. Okay, so there's no problem with that. So I think I have answered pretty much every question, and thank you so much for joining in and tuning in for this session. This was a complete, purely face-to-face, one-to-one talk where I wanted to ask all of you, talk to all of you, answer all your questions. Remember, I'm always reachable for all of you. If in case you want to email me, you can do that. But I would appreciate that if you, instead choose to be a part of our Telegram group, which the link I will show it right now here. You can see that t.me/biotechnika. It's that simple. Just go in here, be a part of our Telegram group, because more such free sessions are going to come up, and we're going to take care of all your queries. Okay. Pranav has got a question. Okay, Pranav, this is the last question for today. Okay, MSc Biotech pass out from JIS University Kolkata, fresher हूँ sir. LinkedIn पे freshers job vacancy में CV mail कर रहा हूँ, but no reply, no CV shortlist, no interview, no job. Now what should I do? Amazing question, Pranav. Please wait for my next session on LinkedIn networking. Okay, it's gonna be live on YouTube. Attend that, and that'll be an eye opener on what's going on. Okay, so that's all for now, guys. Thank you so much for joining. And if you're tuning in from out of India, thank you again. And if you are from India, this broadcast was customized to India, but yeah, in future I'll customize for the global audience as well. And please write to me if you have any questions, because those will become a part of our future sessions like this, where we can take up broader questions, challenging questions, and answer them in a much more interesting way. Thank you so much, and have a great evening, guys. See you soon in the next one. Tomorrow at 7 o'clock, there is genetics, CSIR NET. Don't forget to tune in. Bye, Dr. Tithi ma'am. Thank you so much. Good night. Bye-bye.